Everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And then today I'm joined by Jillian Smith. She is a registered dietitian with a T. I'm all from Tom, not C, T, right? And so she's a registered dietitian, and she's going to talk to us about gut health and gut physiology. We'll talk about testing. We'll talk the immune system. But let's do this. Let's invite Jillian to the show. Jillian, how are you doing today?
Hello, I'm doing amazing. Thank you so much for having me. I cannot wait to geek out with you about all things gut health. Truly my favorite topic.
Awesome. And most people would not say that that's their favorite topic, but for those of us in this space that really enjoy what we're doing, talking about poop, talking about what goes on your GI tract, right? Talking about, bodily stuff. This is our jam, right? So first of all, let's talk about you. You're a registered dietitian. Now, I started off in allopathic medicine, and the registered dietitians were the people that were kind of planning out the meal planning in the hospital. And I got to be honest with you, when you see what they feed people who are sick and in a hospital, it's a wonder they ever get better, right? So you probably had traditional training, and I'm guessing you've diverted a little bit from the traditional training to maybe more of a functional model of nutrition. So tell us a little bit about who you are and your story into more this different side of dietitian world.
Yeah, absolutely. I mean, you're spot on. So growing up, I always had gut issues. I remember ever since I was young, I was not pooping every day. And, going through high school, then college, I just thought that was normal. I just thought, oh, girls don't poop every day. While I was in college, I was studying nutrition. I was really the quote unquote healthiest of all my friends, yet I felt the worst. I struggled with horrible bloating, terrible gas pains. I always say, I remember when I would go out on date night with my boyfriend, and I would literally have to go lay in the back of the car, massaging my stomach because my gut issues were so terrible. I was super constipated. It was really taking a toll, not only on, my physical health, but also my mental wellness and my emotional wellness as well, because it's just really draining. I was bouncing through so many different doctors. I was getting, colonoscopies, endoscopies, everything kept coming back, quote unquote, normal. You're the epitome of health. Everything's great. And yet I still feel terrible. So fast forward to I graduated college. I then went on to some advanced training to become a registered dietitian. I became a registered dietitian, and I was still struggling with some gut issues. I was getting a little bit more control of them through different diets, like the low FODMAP diet. I was doing that, which is a very restrictive diet, and it helps with the symptoms. However, it still wasn't addressing why I was having those symptoms in the first place. So I still wasn't totally satisfied with that. I began working in an acute care hospital. I was in the ER. I was doing, the conventional training. I was in there for about 2 years. And kind of like you were saying, I was having, part of my job was creating these meal plans, giving these supplemental nutrition drinks to some of our patients that were just full of crap, for lack of a better word. And it just really wasn't aligned with me. I always knew I wasn't totally satisfied with that. But when you go to school to become a dietitian, you really don't learn about all the other options that are out there. You kind of learn about food service, or you're going to be in the clinical setting. And neither of those were really working for me. So, I honestly don't even remember how I really fell into functional medicine. I believe it was just on Instagram, kind of poking around. I started learning more about this functional medicine world. And it was like, oh my goodness, what is this? Because you're not taught this in traditional dietetic school. And I started kind of doing some more research, diving more into it. I went on to doing some advanced training in functional medicine. It was like a light bulb moment where I was really able to figure out there's a root cause to my gut issues. And if I can figure out that, I can heal my gut long term. And so I was able to fix my own gut. I went into doing some stool testing, which gave me way more information than I was getting with that colonoscopy, and really addressing from the whole body approach, my nutrition, my stress, my sleep, how all of this was playing such a key role in my gut. And I ended up quitting my job at the conventional hospital and opened up the private practice. And now I am partnered with another incredible functional medicine dietitian. And we now see clients and help women fix their gut issues as well, because I've been in their shoes. I know what it's like, and I know what it takes to kind of find those answers and feel better.
Yeah. So I want to kind of back up a little bit because something you said is really important. Everything you said is important, but one thing that really stood out to me, and I think it's important for us to explain to the listeners, because what happened to you happens to a lot of people. You have symptoms, and then you go into an allopathic setting and you get a scope, or right, and somebody says, hey, everything's good, right? And yet you're symptomatic, right? So, hey, everything's good, you're good. We'll just treat your symptoms. You just have gas, you just have bloating, you just have constipation, you have diarrhea, and now we've got this fancy name for it. We call it irritable bowel syndrome, and it could be IBC, which means you have constipation, but there's no pathology. You have IBD, IBSD, which is diarrhea, but no pathology, or you have a mixed form, right? So can you kind of explain, like, you're familiar with like kind of the Rome guidelines as to what goes on with GI issues and what doctors, why they come up, why would they would say there's nothing wrong when you clearly have signs and symptoms, and why they might say you don't have a problem?
Yeah. So IBS, irritable bowel syndrome, I always say it's a BS diagnosis. And that's what I was, quote unquote, diagnosed with, is this IBS. When all my tests kept coming back normal, it was just, oh, well, everything looks normal, so you have irritable bowel syndrome. And at the time, I was so excited because it was like, yes, I have a diagnosis. They figured it out. What do I do about it? And it was like, well, you manage symptoms. And so it still isn't addressing why you have those IBS symptoms. So there's still a reason as to why you're bloated, why you're having bathroom issues, why you're super gassy. And just saying that you have IBS isn't telling you the why behind all of that. And so it's kind of like an umbrella term that if really they can't figure out anything else, but you have these symptoms, oh, you just have IBS. IBS is a functional, it's a functional disorder. And so it's not going to show up on, for example, colonoscopy, where they're really looking for those structural abnormalities, but there's something that's going wrong with the function of your gut. So it's much harder to find, but there's still a why behind why you have those symptoms. And so if we can figure out the why behind why you have those symptoms, then we can say, and this is what we're going to do about it.
Yeah. So I'll just add to that for the listeners. A gastroenterologist, right there, if you have symptoms, they're going to do some type of a scope. They want to go in there from one end to the other and see if there's pathology. Is there tissue damage and destruction? And if there isn't, there's nothing for them to drug or cut out, right? So they could say it's a normal scope, but there's some inflammation and irritation, but it's a normal for pathology. There's no disease, there's no mass, there's no polyp, there's no hemorrhoid, there's nothing to cut out or do yet, because it's not bad enough yet. They don't have a tool. It's not time for a drug yet. It's not time for something to be cut out. So they're doing pathology-based tests. And what Jillian said was, hey, this is a functional disorder. And typically we have normal function, then we have adaptive changes in our physiology that can lead to dysfunction. And then the dysfunction, if left long enough, starts to create dis-ease or disease process, right? So when you get a diagnosis of irritable bowel syndrome, as Jillian said, it's a BS diagnosis. It's essentially telling you what you already know. You already know your bowels are irritated, irritable, right? And you already know you're constipated. So they're just labeling what you have and saying, well, if you're constipated, we'll give you something for constipation to make you poop. If you have diarrhea, we'll give you something to stiffen you up. And if you're bloated, we'll give you something for that. If you have reflux, we'll give you something for that. But they're just taught, and this is not like your doctor's a bad doctor. They're doing exactly what the guidelines tell them to do. If there's no pathology, treat the symptoms. It's a functional disorder. And it says right in the Rome guidelines, this is a functional disorder, which you would then think somebody would say, okay, well, then let's assess function and run a functional test. But that's not what happens. They're told to treat the symptoms, recheck next year and see, and you keep checking until you find the pathology, and now you have something to work with. So I say that because sometimes what we do is we say, these are terrible doctors because they're not doing it, but this is what their medical guidelines are, which sounds bad, but it's actually good because we are the people that do deal with the functional part. So that's where we come in and we say, listen, you don't have pathology yet, but you have dysfunction. If you want to address the root cause issues, then we can help you address the dysfunction before you have the disease. Is that fair to say?
Exactly. Could not have said it better. That is spot on. And that was really my experience too. And so it can feel really frustrating as the patient to just be like, oh my goodness, I feel like I'm just kind of covering up these symptoms. I was just given medications to make me go and to relieve that constipation, but it really wasn't figuring out why I was so constipated in the first place.
Yeah. So now you're dealing with this on a regular basis, right? This is your jam. This is what you do on a daily basis. So somebody comes in, like, what are like the common signs and symptoms when somebody comes in? Like, there are people that definitely have GI symptomatology, right? And have no pathology. And there's people who have problems in the GI tract, yet don't perceive that they have problems in the GI tract that lead to other issues. So what are some of the more common signs and symptoms that people show up for help with?
Yeah, absolutely. So you have, those more overt digestive symptoms like the bloating, the gas, the bathroom issues, the reflux, the heartburn, nausea. But what some people don't understand is that gut issues or gut imbalances can also look like chronic fatigue, just always lacking energy. It can look like skin issues. It can look like imbalances with your hormones. It can look like autoimmunity. It can look like so many different things. What they say is that the gut is the center of all health. It's sometimes referred to as our second brain. And it does have such a critical role in even our mental wellness because of that really powerful gut-brain connection. So you can totally have those overt digestive symptoms, but they can also look like other things. And so I do have some clients, who come in and they tell me that I just don't feel like myself. I just feel off. I don't have the energy like I once had. And by rebalancing the gut and really figuring out, okay, what's going on at the level of the gut, really so many of those symptoms can be resolved because the gut's running the show on it all.
Yeah. And for the listeners, it's really important. Everything essentially goes in through the GI tract and almost everything comes out through the GI tract. So if you have problems with the GI tract, then even if you're eating a pretty healthy diet, that can impact what you spend all this money on good quality food, but you're not breaking it down, you're not absorbing, you're not digesting the nutrients. And then the other thing that can happen is if you have a compromised GI tract, now you can't push things out and detoxify things well. So where people get themselves in trouble is they say, hey, they don't realize, or maybe they do, that they have a GI problem. But they say, I'm going to go do a detox cleanse, right? And try and push a whole bunch of toxins through a liver and a GI tract that's not very healthy to begin with, and then find out that they feel worse, right?
Exactly. Yeah. A saying that's out there is you're not what you eat, you are what you absorb. And it's so true. If you're not breaking down and absorbing all the nutrients from your textbook, perfect, healthy diet, you're not going to be reaping all those benefits. And I love that you brought up the whole detox process because that's huge. If you're constipated and you're not taking out the trash every single day, those different toxins and chemicals and different excess hormones can get released back into circulation. And so we have to take the trash out all the way to the toilet is what I always say.
Yeah, it's funny. I had a client who she only went to the bathroom once a week, and she didn't have gut issues, she said, but she had a whole bunch of other problems. And we're talking about bowel movements, and I said, how often do you have a bowel movement per day? She goes, per day. I don't do that. I go like once a week. And so I was like, what? And so she's having a bowel movement once a week. And it was funny, not funny, but funny. When we started getting her healthier, she's like, I'm going like to bathroom like twice a day. Like it was like a disruption in her lifestyle now to have 2 bananas pass a day, right? I'm like, no, this is actual normal. That's why you're feeling better. I know it's a little bit of a hassle because, she's one of those people that likes to only do a number 2 at home, right? Not the office or all that stuff. I'm like, you need to go once or twice a day. So anyway, let's talk about somebody walks into your office, and I think very few people are going to walk into your office with a stool test, right? So more often people walk into an office with some blood work, right? So do you use blood work at all as a tool to look at and say, hey, we have indicators here that you likely have problems stemming from a GI tract?
Oh my goodness, 100%. I love seeing the blood work for many different reasons. Number one, it can tell us, about some different nutrients where we can kind of hone in on if you have any nutrient deficiencies. But also, I love looking at it from a inflammation standpoint. So there's different markers that we can look at that can show inflammation. I love looking at blood sugar markers because if our blood sugars are all over the place and inflammation is kind of running rampant in the body, that can make healing the gut really, really hard. So you can kind of get into this vicious cycle. If you have a lot of gut issues, you can be having a lot of inflammation running about in your body. But if you're having a lot of inflammation running about in your body, it can make it really difficult to heal the gut. So I love pulling in some blood work, and I think it can be very, very complementary for the whole process of healing the gut to have some of that information to figure out, okay, what's going on? Let's make sure that you have all of the necessary tools that your body needs to heal your gut, cover up those deficiencies, get everything addressed, bring down inflammation, and then let's start digging into the gut and figuring out what is going on in there and start rebalancing.
Yeah, I think a good comprehensive blood chemistry, and that means different things to a lot of people, but when we look at a comprehensive blood chemistry panel that has inflammatory markers, that has blood sugar markers, that has a full thyroid panel, that has lipid markers, that has iron regulation markers, that has a lot of our CBC, differential, all those things on it, we can see what I teach people and what I teach my clients as well is we can see that gives us a 30,000 foot view. So we can see, do we have markers of inflammation? All right. Now we know we've got inflammation. Where's it likely coming from? And there's markers like an elevated alk phos on a blood chemistry panel that might say, hey, we got problems in the GI tract, problems with albumin, globulin, protein levels that give us an assessment of what's going on in the GI tract, maybe an elevated BUN. So it's for the listener, if you feel unhealthy and somebody says all your labs are normal because you don't have an H or an L, that's not a lab interpretation. That is just reading a lab for H and L. What somebody like Jillian and I do as functional medicine practitioners is we look for patterns of problems, right? We want to use that blood work as the 30,000 foot view. So do we have inflammation? Do we have markers of gut malabsorption? What other tissues are being impacted? Blood sugar regulation, thyroid physiology. And that gives us an idea that, hey, where do we need to look? Where do we need to start? And often it's not unusual that the GI tract is a place to start, right?
Absolutely. Yeah. I love that you brought up the trends because it's so true. Many, many times we can get blood work done and maybe you or your practitioner is just kind of running through the list looking for those H's or L's. And what we really need to be doing is looking at these markers, seeing how they're impacting other markers, what trends that we're seeing there, and how really this is fitting the whole picture for you. Because I'm sure we'll get into the whole personalization piece, but we're all so unique and we have to be taking into context who the patient is sitting in front of you and what their clinical picture is, and bring that while you're interpreting the labs.
Yeah, and that's a really good point. Labs all have to be evaluated in context of the person who's sitting in front of you, their signs and symptoms, their medications, their supplements. And if you don't take those things into context, sure, you're only looking for an H&L, something you can hammer higher or lower with maybe a medication or supplement. But I think a good functional medicine practitioner is looking for patterns of problems. They're taking into consideration everything else that's going on. And I say this a bit, but I think it's a good time to discuss this one more time. At least in my opinion, you tell me when I get finished if you do something different, but I'm looking for patterns of problems. But the other thing is we have to interpret the labs versus just read them. And so what that means to the client is you could have it doesn't matter if you're using optimal ranges in like we call functional ranges, or you're using a lab reference range, which are disease ranges typically. But that lab value could be normal and totally appropriate, right? You feel great and your labs look great. It's probably normal and the value is appropriate. A lab value could be normal and totally inappropriate, right? Happened today. A woman who's about 100 pounds overweight is told there's nothing wrong with her thyroid physiology because her TSH is normal. Okay, so they only ran a TSH on the screening test. Now, clearly, this is a person who's thinning hair, no eyebrows, 100 pounds overweight, has got diabetes, right? Fatty liver disease. Guess what? She has tissue hypothyroidism without a doubt. There's no way she does not. But what the doctor didn't do is run inflammatory tests to see whether the inflammation was suppressing her TSH and keeping it normal. So he didn't look at things in context. He looked at a TSH value. It was normal, so he assumed that that was appropriate. All he had to do was look at his health history, look at the patient sitting in front of him, listen to her complaints and say, I know that's normal. Now I got to find out why that value is normal when it shouldn't be. Does that make sense?
Absolutely. And, I think it's so important to not just take things at face value. And if you are having symptoms and the labs come back, quote unquote, normal, optimal, they're great. It's like, okay, great, but there's still something else going on. So it just requires extra digging. There's something that's going on there. And so that's another thing that I'm always super passionate about, is helping people be their own advocates and really continue seeking. Because if you know that something's off in your body and just something is not right, you are absolutely correct in that. And there's always more to the story. And so if you're not getting the answers, we just need to do some more digging.
Right. And there's two other pieces to that I want to add on there. You could have an abnormal lab value and it's totally appropriate. And those are the things we want to see, right? When we're looking at, if you have, let's say it's hypothyroidism, you have signs and symptoms, and you have a low T3, that's abnormal. But that's totally appropriate for you. So now we go, great, this matches what's going on, right? You have 7 markers of malabsorption on your blood panel. That's awesome. That tells us you have a gut issue. So those values are abnormal, but they're pointing us in the direction. So abnormal is not always bad. Abnormal can be totally appropriate and is sometimes a really good thing to see, because sometimes people see blood value, oh my gosh, everything's bad. Well, yeah, because you feel bad. And now we have something that matches. And there's one other component, and this is one of the things that you could have a abnormal lab value and it's totally inappropriate for the person that presented, right? So you have the person totally fit, look great, feel great, work out hard. They're just coming in for a screening, for a checkup. Tell me how healthy I am. And you get a CRP back. A C-reactive protein is an inflammatory marker for the people listening, and it's 42. Now you're going, okay, either the lab got that screwed up, or I've got a patient who's got a more significant thing that we've got to really dig into, right? And that's happened to me probably a dozen times in 28 years, where somebody thought they were super healthy, came in with a sky-high CRP, double check it, still high, send them off the oncologist, and sure enough, they've got some form of cancer. So those are the things that I think that a good practitioner is going to do when they're looking at blood work. They're not just looking for an H or an L. They're taking all those criteria into consideration, as Jillian said, in context with your signs and symptoms, with all the other stuff that's going on. So I think we got that covered. But now, when we think there's a GI problem, we can run GI tests, right? Now, there's tests that we run. And I often hear people say, well, I went to the gastroenterologist and they did a stool test and they said everything's negative. So can you kind of maybe touch a little bit when a doctor does the stool test in an allopathic world, and we do a stool test in functional world, they're typically different, right? So can you give a little insight into the difference in the test? And then we'll talk about more of the functional stuff. But the difference, it's interesting because you see people all the time that say, my doctor did a stool test, everything's negative. And then we run a stool test and here's a whole bunch of stuff that's wrong. So what's typically the difference between what a gastro is going to do and what we might do in functional medicine?
Yeah. So I hear this a lot. A lot of my clients come in and say, oh, I already had a stool test done with my doctor. The truth of the matter is there's a lot of different tests out there. And I would say that there's a couple of things that we have to kind of think about here. Is number one, the different types of tests is going to matter, right? Different tests are looking for different things. Maybe the quality is not quite there. Maybe it's a different lab. There's so many different differences that could be going on there. And then also kind of thinking about the practitioner who's interpreting it. And is that really their zone of genius? Did they just kind of run it? Like we said, same thing with the blood work. Everything comes quote unquote normal, looks good, nothing came up. But it's like, okay, well, let's really take this into context with the patient. So there's a lot of different things that are at play there. There's also some of those direct to consumer ones that you can order for yourself online. And then you are kind of left to interpret it on your own, or maybe you'll get an email with a quick little synopsis of what's going on. The one that, and I know we were kind of talking about in the beginning, the different stool tests that we use, I use the GI map. I really like it just because it does give a lot of information. We're actually looking at the DNA, the genetic makeup of the different bacteria and the different microbes that are living in the gut. It's a very sensitive test. And I always tell my clients, because I get this a lot, people say, well, what if this is just another test that comes back normal? And I always say, trust me, if you have symptoms, we are going to be working in such a close vicinity that we will find something that comes up. And I know that you are not feeling well. I know that you have symptoms, and I'm very confident that we will be able to get you some clarity through some of this testing because it gives us so much information.
Yeah. And I'll add to that, when you typically in an allopathic world, when somebody's got diarrhea, or they got GI issues, a doctor is going to do a more pathology-based testing for pathogens that are known to cause diarrhea, right? That are known to cause. So they'll do maybe H. pylori, they'll do E. coli and salmonella, and maybe parasites, maybe not, right? I really don't even see them run like yeast and those types of things very often, but it's more pathogenic bacteria is typically what gets done. There are the tests that direct to consumer tests, and I haven't seen a really good direct to consumer test. I think they're really taking a look at the bacteria in the stool and giving somebody feedback. And I don't think those are very good tests, in my opinion. You don't have to throw yourself under the bus here. So I'll do that for myself, but I don't think they're very good tests. And I don't think there's enough support as to tell somebody what to do based on what's going on there. And I don't think they have enough science yet. I think what these labs are doing often is collecting data, right? So now they're getting a lot of data that they can use somewhere down the line at a patient's expense. So I don't recommend people go out and buy some of these direct to consumer tests, because unless you know how to interpret them and what to do with the results, it's a lot of money spent. It's of little value. But there's tests that we run. There's a number of companies. Doctors Data has a test. There's Genova has a test, GI Map test. There's the Gut Zoomer. But you do the GI Map. I've done the GI Map test on a lot of patients in the past as well. So let's talk about some of the results that we might see on there. There's definitely, it does look at some of the same pathogenic organisms that your gastroenterologist may run. And typically, I don't see a lot of those. Now, I say that today, and today I looked at 3 tests that had pathogenic organisms on it. And last week I had somebody with a tapeworm, somebody with a roundworm, and that doesn't come up that often, but it looks at those, right? So let's walk through some of the markers on the test and maybe give our clients an understanding of what they mean, because some of these people may have already had a GI Map test or a Gut Zoomer test or one of these tests. So, but they may not really understand. I don't really understand what it means. They just told me I have a problem. They gave me some supplements. So let's talk about some of the markers and maybe what they mean.
Absolutely. So it is very, very comprehensive. And we are looking at different pathogens that could be in the gut. Like you brought up earlier, the different, E. coli or C. diff, salmonella. We're looking at some of those nasty pathogens as well as parasitic pathogens, some viral pathogens. We're looking at H. pylori, which is this bacteria that can live up in the stomach. We're looking at your commensal bacteria. So this is your good gut bacteria. So I always describe it to my clients like this is the bacteria that when people talk about the benefits of having a healthy gut, it's these little guys who are making all those things happen. So we're making sure that you have appropriate balance of your good, healthy bacteria. We're looking at some opportunistic bacteria, which is kind of the not so great guys. When they really get the opportunity to overgrow, it can cause a lot of symptoms. We're looking at different fungi and yeast. We also get some intestinal health markers, looking at your digestive organs and kind of getting some insight on how well those are running. So we're looking at steatocrit. We're looking at the elastase, which is a marker for our pancreatic enzymes, which we need to break down our food well. And if you're not breaking down your food well, of course, you're going to be feeling super bloated and gassy and not so great after you eat. There's a couple markers on there for the inflammation. There's an antibody against gluten. It's just one single, but it can be kind of helpful just to kind of giving us an overall picture of what's going on. So it is a great test because we get so much information. And a lot of these, some of the nasty little bugs that I was talking about, these can absolutely cause a lot of symptoms. They can absolutely stir up a lot of inflammation. They can really break down the gut lining over time, causing some of that intestinal permeability. And once that happens, your symptoms can really go all over the body, which is why your gut issues can also look like things that are outside of those overt digestive symptoms. So we really get a big picture of kind of what's going on in the environment of your gut.
So let's talk about some of these markers and let's talk about pancreatic elastase. One, what is it? What does it mean to the average Joe? And then when we see a low pancreatic elastase, we'll talk about why it happens, maybe what are some of the potential reasons, and what do we do about it? Okay, so in general, what is it?
Yeah. So, like I was saying, it's those pancreatic enzymes. And so it's these enzymes that come out of your pancreas. There are digestive enzymes. They're breaking down our food. So they're different lipase, protease. They're coming out, they're breaking down our carbs, our fats, our protein. So every time we eat, we need to have these enzymes come in to help break down these foods into super smaller molecules so that they can be absorbed into the body and we can reap all the benefits of those nutrients. If you don't have enough of those enzymes coming up, if they're not sufficient, then you're not going to be optimally breaking down your food appropriately. And this can lead to a lot of discomfort after meals. So some of the symptoms that can look like this is bloating after meals, feeling like rock is just kind of sitting or your food is sitting like a rock in your gut, being really gassy. It can also look like, those bowel movement issues. And so we need to have appropriate numbers for those enzymes so that we can properly break down our food. And there's a couple things that can lead to this decreased number of those pancreatic enzymes. One of the most common ones that I see is low stomach acid. So we have to have appropriate stomach acid levels in order to trigger the release of those pancreatic enzymes. And low stomach acid is something I see a lot in my practice. And I mean, we can just keep on going down the rabbit hole of, okay, why do you have low stomach acid? And there's so many things that can be contributing to low stomach acid, but it's kind of, I always describe digestion needs to be a top-down process. And we kind of have to work our way up. Where is this all starting and kind of work our way down?
So let's talk about that.
Yeah.
It's a top-down process, right?
Yeah.
So most people are told they have too much stomach acid, right? So we're going to make a little tangent here, all listeners, right? We started talking about the task, but we're going to talk about this. It was something I was going to come back to, but since you got into it, we'll get into it. Most people are told they have too much stomach acid, right? That's why they're burning, they have reflux. Is that really the case?
Maybe not. And this is actually something I see a lot. So sometimes your reflux and heartburn and that burning could be due to low stomach acid. So we need to have an appropriate pH of the stomach. So it needs to have enough acidity to keep our sphincter closed. So there's a little sphincter that connects our esophagus down to our stomach. And if we don't have enough stomach acid, if the pH gets a little bit too high, so it's not acidic enough, that sphincter can kind of relax, which allows the contents of the stomach to climb their way up the esophagus. So that's not an issue of having too high stomach acid, yet that's typically what people are told. And I see so many people come in on long-term PPIs, those proton pump inhibitors that really decrease our stomach's acid production. And the truth of the matter is we don't want to decrease our stomach's acid. We really need appropriate stomach acid levels for so many things. Number one, it's protective for us. If you think about it, every time we eat or drink anything, we're bringing the outside world in. And so there's a lot of opportunity to be bringing in some nasty gut bugs that we don't want inside of our bodies. And our stomach acid, a big purpose of it is to kill any of those incoming pathogens so that they don't continue on and take up real estate down in our gut. It's also really important for different food breakdowns, particularly our proteins. So we need adequate stomach acid to break down our proteins. We need stomach acid to absorb certain nutrients like iron and B12. And so the minute we start to really decrease that stomach acid, it can open up the door for a lot of bad things to happen. And this is typically where I see a lot of like SIBO, that small intestinal bacteria overgrowth. If you don't have the stomach acid to kind of keep your bacteria levels at bay, they'll start to overgrow and it can cause a lot of IBS-like symptoms.
Yeah, so I'm going to add a little bit to that. This is a really important part. Like when we're talking about let me do this. Even if you take a proton pump inhibitor, that does not stop the reflux. Okay, you still have reflux. What's happened is the pH is not as intense, and so you're still refluxing up into the esophagus often. but it's at a pH that's not damaging and eroding the esophageal lining. So even though you don't have the burn, you're still having poor digestion, you're still having problems. And then as Jillian said, if you don't have the right pH of that stomach contents becomes this stuff called chyme, right? It's all mixed together with the acids. And when you get to the right pH in the stomach, that's what makes the upper sphincter tighter and the lower sphincter open to start moving those contents into the upper part of the bowel. And then you get the release based on the pH and how much fat's in there. We get bile release and pancreatic enzyme release. So they're really important. But even more important, even before that, maybe is your state that you're in, right? So I talk about this all the time. We're either in homeostasis or allostasis. Homeostasis is a low stress state. Allostasis is an excessive stress state. When you're in stress, you're running around, chasing around, running around, trying to eat on the run, doing all these things. You're in more of a sympathetic state, not a parasympathetic state. And almost all the digestive process is parasympathetic driven, right? That part of your nervous system drives the enzymes and acid productions. And so if you're in more of a stress state, your stomach is like, it's just like, think if you were being chased by the tiger. If you were being chased by the tiger, you're not going to stop and have a meal, right? So your body's not putting time and attention and energy into stomach acid production, into pancreatic enzyme production, and any of the digestive capacity. So starting to have good digestion often starts with putting yourself in the right position to have a meal, right? And I tell people all the time, if you have to eat in between as you're running around to do things, you're probably better off fasting for a little bit and eating later when you have more time where you can be sit and relax. Would you agree with that?
100%. We're kind of working our way up now because now we're talking about the brain and making sure you're in the appropriate state to be eating a meal. As a dietitian, I'm asked all the time, what's your favorite breakfast on the go meal? What's your favorite on the go snacks? And it's like, I don't recommend you eat on the go, because when your body doesn't recognize, like you said, the difference between if you're running from a tiger or if you are sitting in traffic late to work and stressed out about that, it's all the same. And it's going to be diverting energy away from your digestion. So it's going to be sending energy to your heart, to your extremities, so that you can run away from that bear. It's not going to be sending it to your stomach to break down that cheeseburger that you just ate. And so, they call it rest and digest for a reason. And that's the state that we need to get ourselves into in order to properly digest.
I think people get in fear that if they miss a meal, right, then they're going to starve. And I usually have to have that conversation with people like, look, early man and woman did not have a watch. They did not hear the thing 3 squares per day, right? They ate when they were hungry, when they ate when they had food, and they made it, right? But if you're running around and putting food into your stomach when you're not able to digest it well, you're actually probably doing more disservice to your GI tract than you are benefit. You're not going to absorb those calories appropriately. You're going to create more inflammation. So you don't need to slam food down because it's a certain time of the day. You need to put yourself in a position to be able to digest well what you eat, right? And because this is the Thyroid Answers podcast, if you have excessive cell stress and you have decreased, and you've got that cell stress response going on, and you're down regulating thyroid physiology to the digestive tract as part of that cell stress response, or just a global hypothyroid condition, you're not going to make stomach acid because you need thyroid hormone to make it, and many of these other digestive pieces. So we talked about mindset, rest and digest, right? We talked about HCl. Then we talked about the pancreatic enzyme output. What are some, besides HCl, are there other things that you see that reduce digestive enzyme output or that may cause a lower elastase 1?
Absolutely. So what we were talking about when we can look at different microbes on the test, really common one that I see is H. pylori. H. pylori is that bacteria that can live up in the stomach. It's so common. And that in itself can decrease your body's stomach acid production. So again, you need to be having enough of it to trigger the release of those pancreatic enzymes. And then I would say another thing is getting inflammation down. So kind of as you were saying, if you're having a lot of inflammation running rampant in your body, there's going to be things that are not working quite as they should. And so let's say you don't have enough good commensal healthy bacteria in your gut, which play a huge role in regulating our inflammation and making sure everything is running as it should. If you don't have enough of those guys, then other organs within your body, like your pancreas, can be affected and not be doing its job and its function as optimally as it should. And so, there's so many things that, we kind of have to think about. And that's why there's always more answers that we can dig into. And if, everything coming back peachy clean, jelly bean, everything looks great, doing some additional testing to figure out, okay, but there's still something off here. What's causing it?
Okay. And the other thing I'll add to that is, from my perspective, when I'm taking a look at those things, if I see a lower elastase 1 on a GI test, one of those things that we have to start to consider and think is especially if there's signs and symptoms, we'll talk about steatocrit here in a second, but if there's signs and symptoms of biophysiology problems, they've had a history of gallbladder problems. The other thing we need to consider, especially for women, is estrogen. So excess estrogen can cause what they call the sphincter of Oddi to become tighter. And the sphincter of Oddi is this valve that opens up to let pancreatic enzymes and bile acids into the GI tract when you eat. And if you have excess estrogen in circulation, that causes that sphincter muscle to become tighter. And now it's harder to get pancreatic enzymes into the GI tract, harder to get bile flow into the GI tract. And that can create, especially in biophysiology, cause a backup, creates bile sludge. You can get gallstones that start to produce because you're not allowing the stuff to get out of the GI tract and help you digest things. So I would add that. One other caveat that I would suggest too, when I look at and I see a low pancreatic elastase 1, I'm immediately taking a look to see if somebody's got insulin resistance issues. Mm-hmm. And because the vast majority of the pancreas produces digestive enzymes, a small percentage of that goes to make something called insulin. And so when you have blood sugar problems, especially when you have either low insulin production or you're insulin resistant, what's cool about the body physiology is the pancreas will actually hijack some of those pancreatic producing cells to make more insulin. So your beta cells produce the insulin in the GI tract, but if they're damaged or not keeping up, the literature seems to show that they'll hijack some of these pancreatic cells to make more insulin. So now pancreatic enzyme production might go down as a result of the body trying to deal with this blood sugar problem. And on paper, right, that would make perfect sense. If I can't deal with the glucose I already have into the body, do I need more digestive enzymes to bring more glucose in? Or do I need to use that energy to make more insulin to get the glucose out of the bloodstream, right? The body is really pretty smart and intelligent. So when I read that paper a year or so ago, I was like, wow, that is pretty cool. So now that's a big marker for me. And when I take a look at that, right?
Yeah, love that so much.
We talked about the commensal bacteria, and I just want to hit on that one for a bit, because sometimes people are like, I don't know, what's commensal bacteria? I don't get it. Is it? I thought I wasn't supposed to have any bacteria. I don't think my small bowel is supposed to have bacteria. Where's the bacteria supposed to be? Most of the bacteria is supposed to be in the colon. But my analogy, and I'll let you kind of jump in here in a sec. When I talk to people about commensal bacteria and even the opportunistic bacteria, I describe them all as, I live in a neighborhood. There's 114 homes in the neighborhood. And we know there's 5 people in that house, 6 people in that house, 2 people in that house, 4 people in that house. So those are all the commensal families in the neighborhood. They're all supposed to be there, right? Now, within every family, there's a couple knuckleheads. Those are the opportunistic ones, right? And so if I'm looking at the neighborhood and it's been empty for like a house has been empty and vacant for a couple of days, that creates a concern. That would be, and so in the commensal world, if we have key strains of bacteria that should be a certain level and they're deficient, that's a problem. And it's also a problem if these bacteria that are supposed to be there are overgrowing. Like there's a couple neighbors in my house, and now all of a sudden there's like 40 cars there every night for the last couple of nights. That's a problem too, right? So we talk about the commensal bacteria like they're good bacteria, but if they overgrow or undergrow, that can also be a problem. Even though they're not pathogenic, they can cause problems because they're too high or too low. And some of these bacteria play really well together, right? And so if they're gone, some of the bad guys come in, right? The knuckleheads in the family come moving in. And when we have a good balance of the bacteria, it tends to keep the knuckleheads low. Do you see the same thing?
Absolutely. Yes. I always say, you want to have a good balance. It's not a matter of having a ton or not having any. You want to have them in a good balance, and you want to have them in the right location. Like you were saying, we want pretty much all of our bacteria to be down in the large intestine. The small intestine is really where we're doing our nutrient absorption. We don't want a lot of bacteria up in there. That's where, when that bacteria does start to kind of translocate and make its way up to the small bowel, that's where we can really start seeing the SIBO, like I referred to earlier, the small intestine bacterial overgrowth. And that's actually makes up about almost 70% of those IBS cases. So if you were told you have an IBS diagnosis, very, very common that you might have some of that SIBO going on. And so we do want to make sure that you have a good balance of bacteria, not too much, not too little. It's like Goldilocks. And we want to be sure it's in the right locations. And so that is something that those comprehensive stool tests give us great insight into, is because we can check for the balance and make sure that things aren't going too haywire. Or if you do need support in certain beneficial species, that we can give you that support and boost it up so that it's in a good balance.
So there's another marker on there called steatocrit, and some tests have steatocrit, some are measuring triglycerides and cholesterol and phospholipids. But what does that steatocrit marker indicate, and what are signs that somebody might realize they're having problems with steatocrit levels?
Yeah, so steatocrit is kind of looking for some fat in the stool. So we don't want to be having fat in the stool. It means that you're not digesting, absorbing your fats well. Some of the symptoms that can go along with this are floating stools, mucus in your stool, kind of looking like there's an oil streak in the toilet after you go. Also can be like a lot of bloating, discomfort, particularly after eating foods that are high in fat, or like fish oils is another one. If you burp a lot after taking fish oils, that can be another sign that you're not digesting and absorbing your fats well.
And so we've got, if we see high steatocrit or high fats in the stool, that's not a good sign. And the other thing that you have to keep in mind is those fats typically don't go into the stool by themselves. They typically pull things with them. And so they have a tendency to pull minerals with them. And so calcium and magnesium wind up getting bound to the fats. And now you wonder why, hey, why am I always deficient? Well, maybe one of the reasons you're deficient is because you're not digesting your fats very well. And you're kind of depleting some of those minerals. And it can potentially create problems with even things like oxalates. If you're disassociating the calcium and oxalates in your food, the calcium goes out with your fats, the oxalates can get transposed into the body, and now those oxalates can potentially cause some problems.
Yeah. And I would also add to that, detox is another big one. I mean, our bile, which is the substance that emulsifies our fats, if that's not working properly, you're going to be having issues with detox, because bile plays a huge role in detoxing our bodies and taking out the trash. So that's another why bile is so important.
Yeah. And I've done a couple of presentations on bile and biophysiology. And one of the things that I see in people who get diagnosed with chronic irritable bowel syndrome, chronic SIBO, they've taken multiple antimicrobials, antibiotics, and it still keeps coming back. Oftentimes I see that nobody's putting any attention to what's going on with biophysiology in the terrain. And so if we think about bile, your liver pulls cholesterol from the bloodstream, and with the help of a bunch of chemicals, and one of those hormones that really helps with production and flow is thyroid hormone, we take this cholesterol-based stuff and move it into the GI tract. The digestive enzymes from the pancreas help start breaking down the fats, and then this bile starts kind of helping kind of emulsify the stuff, and then we pull some of the stuff in, and some of the fats that we're trying to get rid of and toxins go out in the stool, and that bile helps us bring some of the fats that we break down as triglycerides into the body as free fatty acids. But bile plays a couple huge roles. One, bile is an antimicrobial, a direct antimicrobial in the upper part of the GI tract. So it directly starts destroying some of the bacteria. And indirectly, as bile is reabsorbed in the lower part of the GI tract, it actually helps maintain what are called the tight junctions of your GI tract. And if you've heard that term leaky gut, then your intestinal cells are one cell layer thick, they butt up to each other. And when those junctions in between become more permeable, then more undigested proteins and peptides and toxins can leak through, and bile helps maintain those tight junctions. So really, really important as a direct antimicrobial at the top and indirect antimicrobial at the bottom, helps with fat emulsification and absorption, helps us get rid of toxins, but it also helps maintain our tight junctions. So really, really important. I'm glad you said it. My friend Kelly Halderman, who coined the term detox 2.5, talking about how we get bile out of the liver and into the GI tract, would give me a hard time since I forgot about it. But we talked about that. Let's talk about, there's something called secretory IgA that people might see on their tests. What is the secretory IgA? What's the significance of it?
Yeah, so secretory IgA is really looking at the immune function within your gut. So maybe listeners have heard that there's a large majority of our immune system resides within our gut. And it makes sense because, like I was saying earlier, your digestive system is really having to control the outside world that you're bringing in. So we need a lot of immune cells within our digestive system and kind of playing a part with all of that so that it can keep us safe and healthy. And so a lot of times we can see depressed secretory IgA, which means that your immune system is a little bit down. I also see it sometimes really elevated, and I always describe it, it's like your immune system is kind of screaming out to something, whether it be an antigen or maybe an infection that's going on, a lot of inflammation. But I also see it low a lot. Many times I can see it low with chronic stress, because cortisol, which is our stress hormone, if we have long-term elevated cortisol, we're too stressed out, high cortisol will lead to low secretory IgA. And so really taking a look at stress, also like food sensitivities, because we want to be sure that we have an appropriate immune response going on in our gut. Again, kind of like the bacteria, you don't want it overreacting, but you don't want it underreacting.
And so I always look at the secretory IgA system like a teeter-totter, right? So I need that secretory IgA to, it's like my defense, right? It's like the Marines, right? All your mucous membranes from nose to anus, right, has this immune system, and we don't want it to be hyperactive, right? Because it might kill everything, it might kill all the bacteria, but now it might increase my reactivity to a lot of food peptides, right? I may start to be overreactive to things, and we don't want it underactive because then bacteria can overgrow. There's nothing keeping it in check, and even I see in low secretory IgA states, even those people start to have food sensitivities and food intolerances. I think it's a different mechanism, more weakness and cross-reactivity. I say it's like when your secretory IgA system is low, it's like dating identical twins, right? It is, your immune system is so compromised, it's looking at peptide structures or pieces and saying that's close enough, and I think that's the problem. So you could see food sensitivities or food reactivity with both high and low secretory IgA processes, but I think the mechanisms are a little bit different. Would you agree with that?
Absolutely. Yeah.
And then there's a test called zonulin. Can you talk about what that might indicate on a GI test? What should somebody be concerned about there?
Yeah, leaky gut. So that intestinal permeability. So zonulin is a protein that our body produces. So it's not necessarily a bad thing. It actually plays a very protective role. Let's say you get some food poisoning. Zonulin is really helpful for helping your body clear that out. But what the problem is that what zonulin does is it opens up those tight junctions that you were referring to earlier of those intestinal cells, and that can lead to that leaky gut picture. And so when we're having too high of zonulin going on, that can be leading to that leaky gut picture. And so, yeah, you can actually test for this protein, and if it's super elevated, then this could be indicating that you might have some of that leaky gut going on, and your intestinal cells are not sticking together like they should. Things that are not supposed to get out of the GI tract are able to escape, different food particles, bacteria, and we don't want that, because then it right on the other side is our immune system can launch an inflammatory cascade, and that's when all kinds of issues can start happening.
So I often hear people ask me questions like, how do I get rid of my intestinal permeability? And I usually say, listen, everybody's got intestinal permeability, okay? You always have some. I tell people to try and think of their GI tract like the screen door or a screen window, right? There's tiny little holes that allow let the air come in, but keep the bugs out. And that's how your GI tract, it has to have some permeability to it. It has to, okay? But if you have excessive permeability, that would be like me coming and punching my fist through your screen, right? And now not only is the air coming through, but the wasps, the bugs, the bees, the butterflies are coming in. And while the butterflies are pretty and, not inside my house, right? And so that's kind of how I try and explain it to the patients. And I'm like, look, if your markers of intestinal permeability are not lab high, but they're close to lab high, I may have only punched one fist through your screen. It's still too permeable, right? But there's still a level of permeability that we're going to have, but we don't want it excessive because now those undigested things can cross through. How do you explain that to somebody? Like, do you get that same question from someone? Because I hear people say, hey, I want to fix my leaky gut so I don't have that permeability. I'm like, well, you're going to have permeability, right? And it's going to be ebbs and flows. So how do you explain that to somebody?
Yeah, I think your description was so great. And that is a question that I get a lot is, how do I fix my leaky gut? Leaky gut has kind of become like a sexy term out there. And people want to know, how do I fix it? And unfortunately, it's not as simple as just taking a bunch of glutamine and pumping your system with a bunch of supplements. We really have to figure out, why is your gut leaky in the first place? What fists are coming through and punching holes into your screen window right now? Because you can be taking, all the glutamine, all those gut healing supplements as you want, but if you're not addressing what the triggers are in the first place, it's going to be really, really hard to heal up that leaky gut. So we have to start talking about, what are your triggers? Is it stress? Is it food sensitivities? Is it chemicals? Is it toxins? We need to address those before we start, doing all of those gut healing supplements, because it can become a wash.
Yeah, and there's something we'll tie in here. I don't think it's on the GI map at this point, but there's something called short chain fatty acids. And short chain fatty acids play a key role in the integrity of the intestinal lining, right? So I'm sure you're aware of butyrate and short chain fatty acids. Can you tell, like, how do we get short chain fatty acids, right? And what's their significance with helping support the GI tract and the immune system?
Absolutely. So yeah, our short chain fatty acids are actually a byproduct of our beneficial bacteria. And so if you're really deficient in that good commensal bacteria that we were talking about, maybe you're going to be deficient in those short chain fatty acids as well. Like the butyrate you were talking about plays a huge role in the integrity of our gut lining and making sure that your gut isn't getting too leaky, too permeable. And so we need to have those. Butyrate is truly my favorite short chain fatty acid. We also have the propionate, the acetate, but the butyrate plays a big role in controlling inflammation. If you have inflammation running rampant in your body, it's going to be really, really hard to heal up that leaky gut. Butyrate really is going to go in and help heal and seal the gut lining. It's the fuel to help heal up those intestinal cells to reduce that permeability.
Yeah. And so that's why those commensal bacteria, when we look at those commensal bacteria, we're looking to say, hey, do I have the right bacteria here? And am I eating the right food? So I have to eat the foods, feed the food, the fiber, feed the fiber that's going to grow the bacteria, that's going to produce the short chain fatty acids, that's going to maintain the intestinal integrity and manage the immune system. So it starts with mindset and diet, and we have to feed the right food. So really key thing. So when you look at a test like that, like this functional test that we're talking about, and there's other markers on these tests, but we won't get too deep into that. I just want to hit some of the high things that are pretty common on a lot of the tests and make sure that people understand that, hey, this is different than what you got at the allopathic doctor, gastroenterologist office said, hey, there's no parasites in there. We're talking about things that give us insight into function and how things work. So and when we see problems in the GI tract, and we start to, especially when we start to see the permeability issues and we start to upregulate the immune system, where we have this increased permeability, it can impact other systems. So that's one of the reasons why when we have thyroid issues, people are looking at the gut, right? When we have blood sugar issues, we're looking at the gut. So you feel comfortable kind of explaining how GI problems might trigger problems with thyroid physiology, and then we'll talk about maybe blood sugar physiology as well?
Yeah, so something that I see a lot are hidden infections within the gut can be playing a huge role into the thyroid physiology as well as our blood sugars because of that inflammation piece. I know we keep on talking about the inflammation, but it's so, so important because if you have some sort of hidden infection or if you're not absorbing your nutrients that your thyroid needs to function properly, of course, that's going to be affecting that physiology. And so they say that the gut is the center of all health for a reason because you need a healthy gut, you need healthy digestion to get the nutrients that every other system in your body needs to function properly. And there's also so much opportunity for having imbalances in the inflammation, which if there's a fire going on in the inside, that can really be throwing off the different systems of different organs within the body.
And I'll add to that, that when we have that permeability, bacteria is supposed to be in the GI tract. I mean, there's bacteria that's supposed to be there. But when you get this permeability to the GI tract, the bacteria can there can be toxic pieces of that bacteria that get into the GI, that get in across the body, get into the lymph, get into the bloodstream. And these are what they call PAMPs, pathogen-associated molecular peptides. And so they're just pieces of the bacteria. And when those pieces of the bacteria start floating around in the bloodstream, they can activate the immune system and the immune system goes, oh, we got E. coli come through. We got some other type of bacteria or virus that's out, and that activates the immune system. But the thyroid gland has receptors for those danger particles too. And so when those danger particles bind to the thyroid cells, if you get enough of those things crossing the barrier and they bind to the thyroid gland, that can initiate thyroiditis, okay, because of the danger signals. So this isn't necessarily broken physiology. This is your thyroid gland getting signals like, whoa, we've got invaders coming into the process. And now that triggers thyroiditis in the gland and now a slowdown in metabolism. You could get those particles that go into tissue. You can get bacteria that translocates from the GI tract into the body proper and gets into cartilage, creates arthritic changes, yeast, things like that can cross the barrier and get into the system. So any tissue is the potential site for problems.
Yeah, I love that. You could really start to see how gut issues can look like way more than just those overt digestive symptoms.
And I had Dr. Vujdani on a podcast previously, and we talked about different components of the immune system, and we talked about different immune imbalances. We talked about the leaky gut. And another thing I think we brought up in that conversation is if you have permeability and damage to the intestinal lining, there's a huge tie here to you're going to have leakiness or potential permeability to other barriers as well, lung barriers, blood-brain barriers. So they can become leaky and permeable as well, right? So how about blood sugar regulation? What do you see as a tie-in between problems in the GI tract, maybe dysbiosis with blood sugar regulation, insulin signaling? Do you see problems there?
Definitely, yeah. So our gut bacteria play a really big role in our metabolic health. So it does play a huge role in our blood sugar balances. I can see a lot of different strains of bacteria that are going to be playing a role in the metabolism of our different foods, regulating our blood sugars, and bringing up that inflammation piece again. Uncontrolled blood sugars can cause up a lot of inflammation and vice versa as well. A lot of inflammation in the body can be throwing off our blood sugars. If that inflammation is coming from the gut and that dysbiosis, maybe too much of the bad guys, too little of the good guys, that can really be throwing off blood sugar markers as well. And so that's kind of bringing back to what we were talking about in the beginning. I love seeing some comprehensive blood work in the beginning when I first start working with the client, so I can kind of see what are your blood sugars looking like, because there's such an interplay with our gut health.
Yeah, and if you're one of the people, if you're a person who says like I have highs and lows of my blood sugar, like I seem to crash a lot, have low blood sugar symptomatology, there's something that happens in the GI tract that has an impact on something called your first phase insulin response. And so when you eat, within 5 minutes, 15 minutes of eating, your pancreas has already produced a bunch of insulin. It's already formed, it's already ready to go. And so that when you start eating that food and that glucose from the food starts coming into the body's already got insulin that's helping to get it into the cells and into the tissues. But that's really reliant on healthy gut function and gut physiology and healthy bacterial balance. So if you don't have good, healthy gut physiology, you may have a reduction of something called GLP-1. And that GLP-1 when there's this sensation that food's coming in and you got healthy gut physiology, that GLP-1 is released, it goes to the pancreas and says, hey, pancreas, let's go, kick it out. And the pancreas starts to release the preformed insulin. If you don't have a healthy GI tract, then you get a delay or you miss that first phase insulin response. And about 50% of the insulin you release to help manage your blood sugar is released in that first phase. So if you lose that first phase, what happens then is your blood sugar just rises and rises and rises. If you got your blood sugar monitor on, you're going to be like, whoa, my blood sugar spiked right after the meal. And then what happens is you get the second phase kicks in as that blood sugar starts to get really high. You start to get compensatory mechanisms that start trying to do something with that sugar because it's too high. And so it already starts on its decline. And now you get the second phase of sugar or insulin release. And now all of a sudden your blood sugar crashes. And then you're shaky and lightheaded. And you're like, I got to eat. I have to eat every 1 to 2 hours. And you think it's a blood sugar problem. It's probably more of a gut issue if you have that type of symptomatology. So that's a really good sign. Even if you don't have gas, you don't have bloating, you have pressure, but you have a lot of roller coaster after eating, and like you crash and you get the fatigue and you get to shake. And you've seen the Snickers commercial where like Jim turned into a crazy person, right? And then they give him a Snickers, maybe not the best thing to give him, but that's an indication of like reactive hypoglycemia where, whoa, we're crashing our blood sugar. Okay. So I think that, that's a huge tie for somebody if they're having really kind of crazy fluctuations and have that crash.
Yeah,
Would you agree with that?
Totally agree with that. And I love that you're bringing up the blood sugar conversation because I truly believe good blood sugar balance is so, so important for overall health. And many of us do struggle with imbalances with our blood sugars. And it's so, so interesting that your gut can really be driving the show on that. And so if you are somebody who's like, what the heck is going on? Taking a look at the gut can be a great first step.
Yeah, I think too many people, especially people who are overweight and have blood sugar problems, they get blamed that you eat too much, you don't exercise enough, and that's the reason why you have high blood sugar problems. Mm-hmm. And I flip the switch on that and say, listen, you have 4 hormones that raise glucose, right? And they're all essentially, you need glucose. So some are stress, cortisol, epinephrine, growth hormone, right? Glucagon, all to drive up glucose. Plus you get glucose when you eat, right? You only have one hormone to lower it, and that's insulin. And so insulin gets beat up, like we're insulin resistant. Well, if you have cells that are in stress mode, right? They're in, danger mode. They're not going to be real efficient at bringing glucose into the cell, because if you have a bacteria or virus inside the cell and you bring more glucose in, guess what you do? You feed that bacteria or virus. So the body has a tendency. The reason I think that most people are insulin resistant or glucose resistant is not because they eat too much carbs, but because they have excessive cell stress and the body's saying, hey, we're trying to slow down metabolism. We don't want more of this stuff. And that's more the reason, because I just see too many people that are trying to do the right thing. They are eating low carb. They're under 50 grams of carbohydrates today. They're keto. And they're like, my blood sugar is still high. How could that be? Because you're in a stress response. The body needs glucose. It's a fast energy. They can make it quickly, make it fast. It's dirty, but we can use it. And that's probably more of the problem than you just eat too much, right? So let's talk about, somebody finds out they got gut issues. Where do we get started here, right? We already talked about testing. They can get a functional test, but if you have GI tests, like what are the foundational things that somebody who's got chronic GI problems, where do they start? Because we got all these diets, right? And should they be carnivore? Should they be vegan? Should they be vegetarian? Should they be paleo? Should they be autoimmune paleo, right? And I think we've done a disservice because we've circled the wagons with the diets and shot in, instead of saying, hey, it should be more of a whole food diet is probably a good place to start. But where do you start at? Like where do you start with somebody who says, all right, I got gut issues. What do I do first?
Yeah, absolutely. So I love that we've been talking about all the testing. I always describe testing though as like the cherry on top. We can't forget about those foundational things that we need to really dial in and work on if we really want true gut healing. So things like our nutrition, like our stress, like our sleep, appropriate exercise, all those things. So when we're talking about nutrition, I'm all about a predominantly whole foods, plant-based diet. So that does not mean plants only, definitely still getting in good, high quality protein sources from meats and different things. But whenever I'm talking about a whole foods diet and people are like, what exactly is a whole foods diet? I always describe it as the foods that are coming from the ground. So trying your best to avoid too many of the foods that come in a box, a bag, or a package, trying to get back to those foods that are coming from the ground that are high in fibers. And so when I say, plant based doesn't mean only plants, but having a lot of plants, because those are how you're getting your fibers that feed that good bacteria that we were talking about so they can produce those short chain fatty acids that we were talking about. It really starts up at the diet. And so when I'm going through the stool test with clients, and if we see that their good bacteria are really, really low, I'm starting with diet right off the bat. And I'm explaining to them, we need to start bringing in more fibers because it's those fibers that are going to be feeding that good beneficial bacteria. So whole foods, plant-based diet is truly where I think it's such a great place to start, pulling out those inflammatory foods, those processed foods, those inflammatory oils, so that we can start pulling out inflammation, bringing in the good stuff.
Yeah, I agree. I think it's the best place to start is a low processed whole food diet. Eat
Yeah.
foods the way they came out of the ocean, off the ground, off the tree, off the plant, right? Right. That's the best place to start. And you might be one of those people who already has gut issues and you don't do well with some of those plants, right? You're like, when I eat plants, I get gassy, I get bloated, I have pain. I have those patients, I'm sure you do too. And then the next question I typically ask is, if you cook it, how do you do? Oh, I do better if I cook it. Okay, cook it for now because you don't have the digestive ability to break it down, because those fibers, if you already have some overgrowth, might be problematic as well. But foundationally, I agree. Start with a whole food diet. Don't worry about whether it's carnivore or paleo or Mediterranean or any of that stuff first. Go with as much whole food that you can. Then we can start having the conversation, organic, not organic, but don't put all the things in to get in the way. Well, I can't afford organic, so I'm not gonna do it. Eat whole food first, right? So that's a good place to start. Totally agree. There are people, no names mentioned, that say plants have toxins and they're terrible for you, right? So what's your thought? Are plants toxic to the physiology, or are they bad for us?
No, I mean, truly, to put it simply, absolutely not. We really, really need these fibers to feed our gut bacteria. If we're not bringing in these plants, we're not going to be getting sufficient fibers to keep our guts healthy, keep that good bacteria thriving so that then we can thrive. Of course, bringing in the conversation of different pesticides, like you said, the shopping organic. Yes, but I totally agree with you. If you can't afford to shop organic, if you don't have access to organic produce, that is totally fine. My personal opinion is something is better than nothing. So if you need to purchase conventionally grown produce, do that as long as you're getting it in. Another little tip that I give some of my clients is stick to the dirty dozen, maybe. You can literally Google the dirty dozen, which is the 12 foods that are most commonly sprayed with these different pesticides. And so if you could shop those 12 foods organic, amazing. Start there. Don't stress too much about having to have everything be organic, because I think the fear of food and, some of these different myths or whatever you want to call them out there, they can create more harm than good. And really stressing too much about these things can be doing more harm to your gut than just having a little bit of freedom and having the confidence that your body is resilient and can put up with some of these different things and not stressing too much about it. Do what you can.
Yeah, I agree. I think we get food anxiety. Like, I'm so fearful of eating everything. And then we wonder why I can't get my gut healthy. Well, because you're creating fear, which creates stress, which then decreases your parasympathetic and digestive capacity. It increases your fight or flight response. So we have to many times we have to meet a client where they are. I've had two or three of those conversations already this week, where people are like, I'm just struggling emotionally with the anti-inflammatory diet. Okay. What would make you feel better? What is have to walk them through that process. And a lot of times it's just mindset, right? And okay, we'll slow the process down. We'll try some different strategies, or we'll give you something back so you can have less anxiousness or anxiety. But sometimes we got to meet people where they are, but it can't be, okay, you're not going to heal the GI tract on the same diet that created the problem, right? So you have to make some changes over time.
Yeah, and those small changes, they add up. And so many people think they have to do the all or nothing and they have to go 100% perfect all the time. And I always say we're chasing progress, not perfection. So the little things that you can do to help support your gut, They add up. They really, really do. And so if we can, start thinking about, okay, I'm going to start doing a little bit more of the plant-based or of the whole food-based and trying to cut out some of those processed foods. I'm going to change out my plastic Tupperware for some glass mason jars. Those little things, they really do add up.
Yeah, and to finish with the veggie thing, right? There is the topic that there's toxins in plants, and the plant toxins can create a problem. Listen, there is, and they can be a huge benefit, because when we think about some of the things that are in plants, they stimulate the immune response in the GI tract. That's not necessarily a bad thing. It is like when we eat small amounts of plant toxins, we stimulate the immune system. It's almost like lifting weights, right? To make my biceps stronger, I actually have to break it down by doing some lifting, by eating plants that provide some benefit to us, but also provide a little bit of stimulant to the immune system that activates the immune system. It makes the immune system stronger. We call it hormetic stress, right? And so if we have this hormetic stress, it actually, even though it puts a little stress on the system, it actually makes us stronger long-term. We become more resilient. So that's the benefit of eating a healthy, diverse, whole food diet, is we're actually strengthening the immune system of the gut by giving little triggers of things that activate the immune system, so that when it really needs to be there, it can be there. Would you agree with that?
100%. And I love that you describe it that way, because it can feel much more empowering, and it does eliminate some of that food fear, that food anxiety, and knowing that your body can handle it and it's actually good for it to give it a little bit of a workout. And so I think that's a great way to think about it, and it comes from a very empowering place.
So you have a program, because this is like your jam. So you have a program called the Gut Fix, right? So can you explain what your program is all about? What do you do? Is this, typically people hear about gut programs and they're getting, hey, take this supplement for 30 days. Everybody gets the same protocol, which, if that's your program, I apologize, but I don't think I'm getting the gist that that's not it. I think we think more alike. We're thinking more along the lines of principles, not protocols, right? So tell us a little bit about what the Gut Fix is all about.
Yeah. So the Gut Fix is how I work with clients. And so I see clients both in private basis, private one-on-one, or in a group program. And really the backbone of the Gut Fix is personalization. So definitely not everybody just gets the same thing, slap a protocol on and we see how everyone reacts. It's not that way at all. Very, very personalized. I typically work with clients anywhere from 3 to 6 months, so that we really have the time to dive into those foundational things that we were talking about. Yes, every single one of my clients, when they do the Gut Fix, gets the stool test, because it is really important to see, okay, what are we dealing with here? And especially a lot of the people who come to me are ones who have been struggling for a long time without answers. So the testing is really, really valuable, but also I built in the time and space where we can talk about nutrition and do some deep diet analysis and the stress, the sleep, proper movement, all of those things. How I always talk about it is, we're so accustomed to quick fixes, and we all want that just quick black and white answer. We want to feel better today. And when we're really working on true healing, it does just take time. If you really want results that are lasting, really addressing the root causes to your symptoms in the first place, it just takes time, and it takes some ongoing follow-up. So when I'm working with clients, we're meeting every other week so that we can make adjustments, we can make updates. Kind of like what you were saying, we have to meet clients where they're at. So if something isn't working, we're going to figure that out and address it and find something that does work better for that person. And so yeah, that's kind of what the Gut Fix is. We have the testing, we have that built-in support, and through different intake forms, health histories, the test results, we can really craft a very personalized healing plan, both with supplements and nutrition, to really accelerate results and just get people feeling better faster.
In my book that I wrote with Dr. Kelly Hellerman, we call it The Thyroid Debacle, part 3 of the book, I think I had somebody say, you didn't provide any supplement suggestions in here. I'm like, right, exactly. Because that's what everybody does, is goes to the part 3 of the book. What supplements do I need to buy to add to my list of 15 supplements that are going to fix this? And it never works that way. And what I heard you say, I thought it was really important. And it's what part 3 of my book is all about. All of what I call the fitness factors. So what's your physical fitness? Whatever if you have low physical fitness, we need to raise that, because your physical fitness plays a huge role in your digestive capacity and your gut flora. Your sleep fitness is critical, because if you don't get sufficient high quality restorative sleep, your gut flora is going to pay the price, right? You have to have good respiratory fitness, which everybody says they have great respiratory fitness, and most people don't, right? Nobody snores, nobody mouth breathes, nobody thinks it's a problem, and it's a critical crisis problem, but it has a massive impact on your physiology. So we talk about emotional fitness. What goes on between the 6 inches of your ears has a massive impact on what's going to happen with your gut physiology. I had somebody argue with me that they didn't think thoughts really would have an impact on it. I'm like, look, are you married? Yes. Remember when you used to love your spouse, right? When you first met them, that first sensation you got when you saw them, you got the butterflies and you were nauseous and you were like, oh my God, right? That is emotion changing your chemistry, right? Or do you like, I always say, do you like standing on a stage and giving a speech in front of like 1,000 people? No. And so what happens to most people? They start thinking, right? Their emotion, they get the P's, right? I got to pass out. I got to piss. I got to poop. I got to puke, right? Because their thoughts change their body chemistry. So it's so important. What I see with a lot of people who have chronic gut issues is they've got poor emotional fitness. And so they're always in emotional fight or flight response. And it's real to them. I'm not saying that somebody's or you just have depression or you just have anxiety. What you're perceiving is real to you, right? But it's your perception, but that plays a role in your health. If people who have chronic health issues and can't get better, I've done gut protocol over and over and over again. They're probably doing the gut protocol, but they're not doing the things that you're talking about or I'm talking about in those other visits, right? Let's talk about your respiration. Let's talk about your sleep. Let's talk about your relationship. Let's talk about your mindset. Like all of those things are important. You want to just kind of talk about that in the last couple of minutes?
Oh my gosh. Yes. I'm so happy that you brought that up. So mindset is actually one of the pillars of the gut fix. So I always have 4 buckets of the gut fix that I work through with all my clients: mindset, lifestyle, nutrition, and then the testing and supplements. Mindset is so important. And many people breeze over it. It can kind of feel a little woo-woo, it can kind of feel a little lofty, and it can be a little like, okay, how are, like you said, my thoughts really impacting my gut? Something that I see a lot with my clients is they don't believe that they can feel better. They don't believe that they can heal. And that can be a huge stopping point in the healing process. And I totally get it, because I have been there and I have gone through gut issues for years without answers, trying everything there is to try with no results. And so I totally understand what it can feel like to just feel like, for lack of a better word, you're a hopeless case, and that this is just kind of it for you, and that maybe this is just the new reality that you have to learn to live with. But the truth of the matter is we really have to start working on overcoming those thoughts, and it takes work. It's not something that happens overnight. But the more we can work on that, I always say step 1 is being aware. So even being aware and being kind of true with yourself, it takes some self-honesty and auditing to really figure out and unpack your own beliefs on your healing and your gut journey. But once we can start making progress in that area, is such a huge needle mover that I see. And I know personally for my own life, it took me a long time to start recognizing that. But once I did, that's really when I started getting the needle to move on my own gut healing journey.
Yeah, I think it's key. And I think to be fair to people who are really struggling is, especially when they're really struggling to make changes, like I feel, I don't know how I'm going to feel, or I don't want to feel worse, right? They have this perception that nothing's worked to this point, and if they change anything, they don't want to get worse. I'm okay with this crappy way of feeling, but I'm afraid to make changes. I'm afraid to take a supplement because it could make me feel worse, right? So they're projecting into the future. So they're okay with their current state of uncomfortableness because they're fearful of what might happen, right? They're fearful that it could get worse. So exactly what you're saying is we have to help them understand, or they could get better, right? And what happens if you stay here? You won't stay the same. You don't ever stay the same. You're either regressing or improving. So if you don't change something and you keep doing the same stuff, whether it's physical, chemical, emotional, microbial, dietarily, you're going to continue to regress. And so it is we all do this. We want to stay in our comfort zone, as uncomfortable as it is. It's what we know. And stepping outside that and trying something different, trying a different diet, trying a different supplement can seem scary. Like, I don't want to do anything different because I may have to go anywhere I may have to go, right? So I don't want to take any risks. But you have to do something different than what created the problem if you want to get healthier.
Yeah, I always say nothing changes if nothing changes. And so we do have to make changes. You can't heal in the same place that got you sick. So we do have to make some changes. And our mindset affects how we adopt changes and how we go about this whole journey of changing our habits. And so working on the mindset piece is so huge. It's so critical and it's really, really important. And, I always say it's never going to be perfect, but just when we can start making those steps, I always try to empower my clients of you have everything within you to heal. Your body is so resilient. It is always on your side and it's doing everything 24/7 around the clock to heal you and keep you healthy and feeling good. And sometimes we are just kind of not listening to that. And we just need to bring out our own healing.
Yeah, I agree. And I think to get well, right, you have to position your mindset in a position like, hey, I can get well, I want to get well, I will get well. It doesn't mean if you just wish it upon a star that it's going to get there, but it's much easier to get there if there's a belief that you can than if you have the belief that, hey, this is not going to work, I'm not going to get better, I can't do this, right? So tell people where they can find Jillian Smith, more about Jillian Smith, the Gut Fix. Where can they find you?
Yeah, so Instagram is truly the best place to connect with me. I love when people reach out in the DMs, asking me questions. I just thrive off of that. So my Instagram is truly the best place to get into contact with me. It's just jilliansmith.rd for registered dietitian. And then the Gut Fix, like we were talking about, we also have an Instagram page for that. It's just the_gut_fix. And it's really, I would love for anybody to reach out, ask me questions, and I'm truly here to talk about gut health all day long.
Well, I appreciate you coming on the podcast. I think we got a lot of information covered in an hour and a half. We could go on another hour or so, but we both have lives. I think we have to lead. And so I'd love to have you on the podcast sometime in the future. Maybe in 6 months or so, we'll get you back and see what you've learned and what more information we can talk about something else. Maybe dig deep into maybe food sensitivity, food testing, and some of that stuff, because that's super, super controversial. But yeah, I'd love to have you back on. So thanks so much for coming on. And I'll let you know when the next episode's out. For all our people listening, make sure you listen to this. This is not a conversation just for somebody who's got a gut issue. This is for just overall health and well-being. So if somebody's got gut issues, if they got thyroid issues, if they just don't feel well, the gut and gut health plays such a huge role in overall health and well-being. Have them listen to this podcast, and then they can realize that there's more that I can do. And especially if they got GI issues and they're stuck in an allopathic model, somebody's telling them you just have an irritable bowel syndrome, they need to look for a functional approach. So Jillian, thanks so much for coming on the podcast, and I look forward to talking to you again soon. Okay.
Thank you so much.